Hey Alice,
Hey, Sophia.
how was your break?
Yeah, my grade was okay, but I'm feeling a little bit unwell.
You look so tired and your appearance look different. You seem thinner than before.
Yeah, I've been feeling more anxious and I get trouble in sleeping. I thought it's only the stress.
That could be hyperthyroidism. Have you ever noticed your heart racing or overheating even when it's not hot?
Now you mention and I've been sweating more and getting nervous for no reason.
Hyperthyroidism is when your gland produces too much thyroid hormones. This can greatly affect your metabolism. You should check out a doctor if you experience any of these symptoms.
Yeah, please do get it. It's better to get the early diagnosis rather than late.
I will talk to my mom. Thank you guys.
Hi Mom. Hi Alice. Are you okay? You've been looking tired lately.
Yeah, Mom. Actually, my friend noticed that I look tired and thinner than before. And I have been feeling so anxious. And also, I cannot calm down. And I also feel like my heartbeat is racing. And I cannot sleep properly. And maybe I think I have the hypothyroidism.
Hyperthyroidism? What disease is that? I'm very worried about you.
I thought it just was the study stress. But when they point out I'm thinner than before, I start to worry it. And I don't know what is hypothyroidism is.
We need to get you checked out. I will book an appointment with a specialist tomorrow and I will go with you. But you cannot ignore the symptoms, Alice.
Okay, thanks, Mom.
It's alright, Alice. We'll find out what's wrong with you.
Hello Alice, how can I help you? I noticed that you have been sweating. Any problem with you?
Yes, I have lost weight and I feel very tired.
Yes, doctor, I've noticed these symptoms also. She has been losing sleep and her heart has been racing. Does she have hyperthyroidism?
Are you feeling nervous and anxious all the time?
Yes.
Oh, based on what you described, that sound like hyperthyroidism. This happens when the thyroid gland produces too much hormone, which speed up your metabolism. So this causes you to lose weight and feel tired all the time and also trouble you in sleep.
Yes, this is what exactly I'm experiencing.
Hyperthyroidism is a common and treatable, especially when diagnosed earlier. We will do some blood tests to measure your thyroid hormone level and check for an overactive thyroid. If necessary, we may do an ultrasound to get a clear picture of your thyroid.
If she does get diagnosed with hyperthyroidism, what are the treatment options?
Treatment usually start with the medication, anti-thyroid medication like the methimazole, also known as MT, and also propylthiouracil are designed to inhibit thyroid hormone synthesis or lower the thyroid hormone level. In more advanced cases, we may use radioactive iodine therapy to skin the gland or even surgically remove the part of the thyroid. However, most patients are able to control their symptoms well enough to live a normal, healthy life and with medication alone. The key is to start treatment as soon as possible to avoid complication.
Okay, thank you, doctor. Thank God we went here.
Alice, what did the specialist say?
Yeah, the doctor said I have a hypothyroidism and I'm taking the medication for it.
I'm really happy that you went to see a specialist.
And you feel better as well, don't worry about it.
Yeah, I feel better now. Thank you for encouraging me to see the doctor. Thank you so
Don't
much.
worry, that's why we are friends.
Hyperthyroidism can affect anyone. However, there are a few factors that could make someone have a higher risk of developing hyperthyroidism. The first factor is gender.
Women are nearly 10 times more likely to develop this disease in comparison to men. The next factor is lifestyle habits like smoking. Like with any other disease, smoking has been associated with the increased risk of developing hyperthyroidism. The next factor is age. Hyperthyroidism is commonly seen in those who are young adults or are middle-aged. The next factor is autoimmune disease. So, by having other conditions like type 1 diabetes, you are more likely to develop a disease called Graves' disease, which is a common cause for hyperthyroidism. Speaking of Graves' disease, this disease can be passed down in families. So, having family history of other thyroid conditions could increase someone's risk of developing hyperthyroidism. Graves' disease can also impact pregnant women. And the impact of this disease can lead to complications like premature births and miscarriages.
Diagnosis. Early diagnosis is essential to prevent serious complications such as heart problems, osteoporosis, or in rare cases a life-threatening thyroid storm. It also improves quality of life by managing symptoms like fatigue, weight loss, tremors, and mood swings which can disrupt daily activities. For women, early diagnosis supports fertility and ensures better pregnancy outcomes by reducing risks such as miscarriage and preterm birth. Additionally, hyperthyroidism symptoms often mimic other conditions like stress or anxiety, making accurate and early testing crucial for proper treatment. Early interventions allows for timely and effective management, reduces healthcare costs, and minimizes the risk of recurrence in conditions like Graves' disease.
Epidemiological term, the prevalence of a disease is the total number per percentage of people that are affected with hyperthyroidism. Research has shown that sex and age have played in the prevalence of disease. In this case, it affects approximately 2.5% of adults worldwide, and more women are affected instead of men due to Graves' disease, affecting 2% of women and 0.5% of men, and is the most common cause of hyperthyroidism.
In comparison with the rest of the world, Malaysia's hyperthyroidism prevalence is at 3.4%, with women being 5 to 8 times more likely to experience this illness than men. In addition to that statistic, 1 in 8 women develop this problem in their lifetime. If left untreated in vulnerable populations like the elderly, it will lead to osteoporosis, heart problems, and increased mortality. To be able to dissect hyperthyroidism's prevalence is important as it notifies health workers about public health planning, what type of screening is necessary, and the burden to the population this disease may cause if left untreated.
As for incidence, it is the number of the newest cases of the disease within a given time. By comparing the past and the current incidence rate, health workers can help assess the risk of developing hyperthyroidism in the past and the present. Because the prevalence rate favors older women seen in the trends, screening the corresponding type of untreated and unexposed population, and distributing the correct treatment may help reduce the past incidence rate. Then, by observing and monitoring the current incidence rate after health protocols have been acted upon, researchers are able to see if their method effectively treated the disease, which would mean the incidence rating is lower.
To be able to see this in a real-life example, according to Sensi et al. 2023, reports of findings of the hyperthyroidism incidence in northeastern Italy in a large population, where the population undergoes the COVID-19 epidemic vaccination campaign and sustained iodine prophylaxis campaign, highlighting the possibility for these large-scale events to affect the incidence rate of hyperthyroidism. The conclusion stated that the SARS-CoV-2 pandemic and vaccination showed no change in the falling trend of hyperthyroidism incidence, while the sustained iodine prophylaxis is the reason for the declining incidence rate of hyperthyroidism, all within the Veneto region.
Now, it's time to quiz your understanding on hyperthyroidism. Try to answer the questions. The first question, which age group is the most affected by hyperthyroidism? A. Children under 12. B. Teenagers between 13 and 19. C. Adults between 20 and 40. D. Adults over 60. So the answer is C. Hyperthyroidism most commonly affects adults between 20 and 40 years of age, especially the women. Question number 2. Which of the following is not a common symptom of hyperthyroidism? A. Weight gain. B. Heat intolerance. C. Tremors. D. Tachycardia. So the answer is A. Because hyperthyroidism will cause weight loss but not weight gain. It's a characteristic symptoms of hyperthyroidism due to increase of metabolism. The next is question number 3. During pregnancy, which anti-thyroid medication is preferred in the first trimester? A. Metimazole. B. Propylthiouracil (PTU). C. Radioactive iodine. D. Beta blockers. So the answer is B, because PTU is preferred in the first trimester due to the lower risk of birth defect compared to metimazole. Question number 4. In elderly patients with hyperthyroidism, which presentation is most common? A. Classical symptoms with heat intolerance and tremor. B. Apathetic thyrotoxicosis. C. Thyroid storm. And D. Graves' ophthalmopathy. The answer is B. In elderly patients, they often present with apathetic thyrotoxicosis, characterized by lethargy and depression rather than classical symptoms like swollen neck. For question number 5, what percentage of all hyperthyroidism cases is attributed to Graves' disease? A. 20 to 30%. B. 40 to 50%. C. 60 to 80%. D. 90 to 95%. The answer is C. Graves' disease accounts for approximately 60 to 80% of all cases of hyperthyroidism, making it the most common cause.
Your health is your greatest asset. If you have been experiencing symptoms like unexplained weight loss, rapid heartbeats, sweating, or irritability, don't ignore them. This could be a sign of hyperthyroidism. Prioritize your well-being and consult a healthcare professional for proper evaluation. Early detection and treatment can prevent complications and improve your quality of life. Take the first step today. Your health is worth it. Don't ignore your symptoms.